One of the greatest takeaway messages that I got from this trip was just how different Japanese and American culture really is. The Japanese culture is so much more professional in their attire and in the way that they act, and they're a lot more respectful of everyone and everything around them. Nature constantly surrounds us, and for people, they're respectful of the culture in the way that they have English or other languages written not only on their menu so that way people can order food, but also on the subways so people know how to get around. And they also even have certain sidewalks that can allow blind people to navigate throughout the streets and to let them know when they're at a wall or at a crosswalk. So overall, they're very professional and just so much more accommodating to everyone. So that was probably one of the biggest takeaways that I was able to encounter from this trip.
On day 2 to our trip to Japan, we went to a life safety center that taught Japanese people and visitors how to survive through an earthquake, tsunami, typhoons, and how to escape buildings that are on fire. For the first portion of our trip, we watched a 20-minute video that covered statistics, facts, and gave us examples of the courses that the Japanese are taking to help prepare their people to survive such phenomena. One interesting fact that we got from the video is that Tokyo has a 30% chance of receiving a magnitude 7 earthquake within the next 30 years. After the video, we were fortunate enough to participate in 4 different simulations. We went through an earthquake simulator that represented a magnitude 7 earthquake. We went through a typhoon that helped us experience what heavy wind and rain felt like. We learned how to use fire extinguishers, and we went through a building that represented smoke coming through and how to escape that.
So what we learned about our host country and what we'd like others to know more about is their healthcare system. Although there aren't many resources to help get food out to those in need, Japan does offer free healthcare to children all through the age of 16, regardless of service they need, including surgery. Japan also has an increased use of robotic technology to help with methods of care and reduce the risk of labor for healthcare employees. Mental disorders specific to Japan include hikikomori, known as social withdrawal, and karoshi, which is death by overwork.
He has to lift this part up, and then he can pull it out. This mechanism is...
なので、これは口をやらずに、中腰の姿勢、主におむつ交換だったり。
Hello, my name is Rick, and I'm going to talk about some of the differences between the United States and Japan that I observed while studying abroad in Tokyo. When I first arrived to Japan, I kept asking myself, why is everybody wearing a mask and where do I get one? Here are some of the reasons why Japanese people like to wear masks. People that are sick or people who do not want to get sick wear masks. It's considered rude if you don't wear a mask if you are sick. Tokyo is crowded. Some people wear a mask as a social firewall to signal a lack of desire to communicate. Some wear masks to hide their face. Women wear them to avoid being harassed by men on the train. To avoid allergies, cherry blossom season is the beginning of spring. For surgical masks in Japan, this is peak sale season. The mask helps to alleviate cold-like symptoms of hay fever. Wearing a mask can be seen as a status symbol. You are considered respectful and polite if you wear a mask. Being respectful and polite are important qualities in Japan, and some people wear them to make a fashion statement. Masks come in different shapes, colors, and styles. Unlike the United States, people in Japan walk and drive on the left side. Only 35% of the world's population drives on the left side. The countries that do drive on the left are mostly old British territories. Japan was not a part of the British Empire, but Japan's first railway was built by the British, so all the trains and trams drove on the left-hand side. Eventually, it became a law that you must drive on the left. Most of the sidewalks in train stations in Tokyo have specially designed yellow paths that lead from one station to another. At first, I thought the yellow lines were used to separate traffic flow. I would always hop over the yellow divider and walk on the left side. But after asking questions and doing some research, I learned that in Tokyo, the yellow lines are a network of paths that connect all over the city. They are designed to be used by blind people as a guide to navigate streets, intersections, and road crossings. Blind people can feel the textures of the lines through their footwear or with the help of a cane, and then they use the patterns to turn right or left, or they will stop at a cross when the pattern of the surface changes from line to dots. The train will stop and the door will open at the squares of the raised dots.
When comparing Japan to the rest of the globe, we can see that it is both an innovator and yet also has points that need great improvement. Using our experience in the American healthcare system as a lens to look at Japan, we can see areas that we should emulate and others that we can help Japan improve upon so that citizens of both countries can thrive. Japan has a unique situation among modern industrialized countries in that their birth rate is not high enough to replenish their population, coupled with a massive percentage of their population aging, 26% growing to 33% over 65 by 2035. Age in birth is a big issue. The first aspect I want to bring to attention is Japan's national healthcare system. As Americans, we are used to healthcare as a business, controlled by politicians and large companies, with the human beings whose health and lives depend on the national policies and insurance seemingly a second thought. In Japan, all medical expenses up until the age of 16 are free. Yep, everything. Everything medical is free. I didn't know that this could happen in the modern world. This right to life, essentially, is groundbreaking to our American lives. All citizens pay into this national health care so that when they need it, they will only have to pay 1/3 of their medical costs, and those costs, to begin with, are much lower than that of the United States. There were many stunned gasps and head-turning as we were told how cheap the massive procedures, surgeries, and month-long hospital stays actually cost the Japanese people. The care is not just cheap, it is effective and personal. There are massive amounts of beds, hospitals, and healthcare professionals in Japan to help their citizens. On top of that, because of their healthy culture, they have a very large age of healthy living, and the number of surgeries that are performed are much lower than in the United States. Furthermore, because hospital stays won't bankrupt you if you stay for longer than 48 hours, the Japanese spend an average of 30 days in the hospital to receive the best care and utilize the knowledge and resources that the hospitals can provide them. This applies also to citizens going into hospitals for checkups far more frequently than they do in the United States. The Japanese healthcare model does not stop at hospitals and traditional care. It expands even to maternity care and maternity leave, where they give mothers 3 years of full pay and the opportunity to come back to their careers after they have raised their child. Also, there is enormous amounts of physical activity in both the elderly that can be seen walking, riding the metro, or even riding their bikes, to the youth of the country. Something that the USA is better at, however, is food distribution, with locations and nonprofit organizations in the thousands, while in Japan we learned that there are only a handful that try to provide food to the needy and impoverished. With everything we saw and experienced, we all believed that in most cases, Japan is doing healthcare right, and with a few tweaks, such as paying healthcare workers better and expanding their food distribution services, they can be the world gold standard for healthcare.
Coming into HHS350, I didn't really know what to expect, and to be honest, I was kind of dreading it. I really didn't see the value in studying abroad. But now I'm so glad that I went. We had so many amazing experiences. We were part of the Shibuya Crossing, we got to see real-life Mario Karts, and even watch a Japanese baseball game. Because of this program, we got a new respect for both the American and Japanese culture. I got to meet so many amazing people, got to eat delicious food, and even got an unforgettable experience out of it.
Finally, for me,